I remember it very well. I was shocked and I couldn't believe it. And I knew that there were no other place in the world where I could get the best knowledge and the best training to give my patient the best treatment.
Many of the big leaders are working there in the lab or in the clinic. This is this kind of opportunity that can one time in your life. So you take or you lose.
My biggest concerns were three. First one, I just opened the 2 clinics 2 years before. Second, I was performing a lot of surgeries, 1,000 implants every year. But I wanted really to perform the surgeries. I didn't want anybody else to do the surgery but me. And the third point, I was gonna get married in 3 months' time.
It was a shock. Because, you know, he telephoned me of San Diego.
I wanted her to feel that excitement that I was feeling right at that moment.
Ilde, we are getting married in April. How? If you want to go Michigan, I don't getting married with you. It's cancel the wedding.
Well, it's not easy for sure at that moment to combine the professional and personal life. My duty at that moment was to get the best knowledge in the world. And if I had to sacrifice part of my personal life, I had to do it.
When he left, some people from our team, from Granada and Jaén, another province from Andalucía, some part of the team, came to supply him in the practice. So we tried to help him in order to develop himself.
I'm absolutely convinced everything is related to the team that you have around you and support you. So they trust me that this was gonna be good for everybody. And I trust them that they were gonna make a great job taking care of my clinics while I was at the University of Michigan. Some of the concerns related to the way I was gonna manage the situation, it was the materials I was gonna use.
When we are taking decisions, we are not thinking about the money. We are thinking about the best thing that we can do for our patient.
They rely on me, they trust me, and they already know that I was using the best materials I could have to give to my patient also a very predictable situation while I was at the University of Michigan. So the plan was going to Spain every 6 weeks for almost 2 years. My team prepared the cases for me. They made the x-rays, they made the photographs. I took the plane from Detroit to Paris, and then from Paris to Malaga. A friend of mine was waiting for me to drive me directly to the clinics to do the surgeries. I stayed for 2, 3, 4 days, and after that, say bye-bye to my parents and Livia and go back to Michigan. I knew there were not gonna be any other biomaterial in the world in which I could rely or I could have better prognosis or effectiveness. And that was the way we could make it. Otherwise, it would have been impossible.
Oye, escúchame, voy a llegar a la parte.
Well, this is a vocation to do the best treatment or to give the best to your neighbors. So, but as far as you are treating human beings, if you give them the right treatment, so you can change their lives. That's beautiful, because that's what I really wanted to do, to feel proud of me, giving them the best of the best.